From Monday, international arrivals into Heathrow and other English airports from countries judged less risky will have to test themselves twice during isolation. All international arrivals into Scotland will be sent to hotels for 10 days quarantine. The rules on international travel are tightening, and no one knows when they'll be relaxed.
I make no apologies for the strength of these measures, because we're dealing with one of the strongest threats to our public health that we've faced as a nation.
Arrivals from the 33 countries on the red list, most of them in South America and Africa, will be escorted on arrival to a hotel to start a compulsory 10-day quarantine, for which an individual would be charged £1,750. There are fines escalating up to £10,000 for those not complying. And if you conceal the fact you started your journey in a red list country, you can face a prison sentence of up to 10 years.
I must say, as a public health doctor of long standing, I have never heard of anything as draconian in terms of a penalty for ignoring public health advice. But it does illustrate, I think, what the ministers must be hearing from their advisors about the seriousness of the situation and the seriousness of a variant coming, which might dodge the vaccines completely.
More hotel rooms could be added to the 4,600 the government has block booked. The government is charging a lot more than it's paying the airport hotels, but says that's to cover the costs of security, transport and testing. For arrivals from countries not on the red list, you're still required to isolate for 10 days. But now you'll also have to test for COVID on day 2 and day 8 of your isolation. And you could be fined up to £2,000 if you fail to take the tests. At Gatwick Airport today, they're already down to only 2 international flights, one from Spain.
The cost of the test would potentially make you think twice about travelling again with it.
I will postpone my next trip, definitely, yeah, unless it's an emergency.
Well, it's much better than paying for the hotel, isn't it?
I don't know. I don't think it's very reasonable at the moment, considering that everyone is struggling so much.
The government says the main driver of whether countries get put on or taken off the red list will be the course of COVID variants in those countries. But some experts say that's not something you can chart with confidence.
We don't know where the most dangerous variants are. The countries don't know, most of them, whether they've got dangerous variants present or not. And certainly the travellers don't know what they're bringing with them. So the only safe way is to have managed isolation for all travellers.
That view echoed today by the Scottish Government.
We believe that all international travellers, with some limited exceptions, should meet the requirement to isolate in managed facilities.
So for all international travellers into Scotland, managed isolation in a hotel, new COVID jargon to add to the lexicon. In the rest of the UK, for now, for most international travellers, self-isolation at home with expensive tests. Well, there was quite a row inside the UK government about whether to go closer to what Scotland has adopted. In the end, I understand what won out for Boris Johnson was a feeling that if you really switch off the tap virtually altogether with just a drip of air travel rather than anything more than that, a trickle reduced to a drip, then it's really, really difficult to get out of those restrictions and get anything like normal air travel back. What does it all mean for this summer? Well, last summer, quite a few Brits gambled on a holiday abroad and managed to duck and dive, weave through the rules. Even if they got to a country and it changed its designation, was suddenly decided to be unsafe. All that happened was that when you came back, you had to stay indoors and you might have an awkward conversation with your boss or work from home. This time round, though, holidays are at the moment illegal. So if you're booking in advance, 3 million Brits seem to have done that. You're taking a gamble there. But if the rules suddenly got tighter, if they loosen, holidays become legal, but then tighten again, you could be facing quite a bill for testing an entire family of 4, say £1,000 or something like that. It's a much bigger gamble this time round.
Gary Gibbon. Now, Channel 4 News has seen a confidential government report outlining why factors like social deprivation, financial hardship among those isolating, and failures in the test and trace system are leading to stubbornly high rates of transmission in some areas of England. The findings in the report have led public health and council leaders in one of the worst affected areas to write to Matt Hancock asking him to consider accelerating the vaccine rollout in areas of high transmission. Here's our health and social care editor, Victoria MacDonald.
Blackburn with Darwin, Bradford and Leicester, linked by their high COVID infection rates. And now a leaked document seen by Channel 4 News and prepared for the Department of Health, NHS Test and Trace and the Joint Biosecurity Centre asks, why have these three areas at different times been worse than the national average? Deprivation, employment and occupation, demographics and household composition are all listed. On deprivation, the document says,
enduring areas have higher instances of unmet financial needs, and therefore compliance with interventions are lower and transmission is higher.
And on response, it says,
persistent delays in outbreak response will see high transmission rates.
Referring to the National Test and Trace system, the document adds,
if individuals are not being contacted or there are significant delays with contacting, this will impact on transmission.
The report also cites Blackburn with Darwin and Leicester as having a higher number of test and trace support payments rejected than being successful. This analysis was for the months from July to November, when each area had high transmission rates and remained under some form of restriction long after the rest of the country. It highlights that the three areas have above the national average populations that are young and from minority ethnic communities. And these communities have, the document says, greater exposure to COVID-19 as they are more likely to be socio-economically deprived, live in overcrowded and multi-generational housing, and hold key worker or high exposure occupations. Now Blackburn with Darwin leaders have written to the Health Secretary citing this document and asking for an accelerated rollout of the AstraZeneca vaccine to high-risk areas in order to assure equal life chances and pandemic exit across the country.
Well, what's clear when you look at areas that have had what's called enduring transmission, so that means high rates since the beginning of the pandemic, is that despite control measures that have affected the economy and the well-being of the population for months, they're still struggling to get the rates down and keep them down. And the reasons are not to do with lack of compliance in the population. They're largely to do with structural, social and economic inequalities in those areas.
In Blackburn, there are double the deaths and 3 times more infections than in the southwest. They have specifically cited the AstraZeneca vaccine because of recent evidence that it may prevent transmission.
So we're very pleased with the rate of vaccination we're undertaking. What we'd like to do is to speed that up so that our risks are equivalent to risks in other regions from the vaccination programme.
The council has so far had no response to its request from the Health Secretary.
Well, where did the pandemic begin? A team from the World Health Organization has delivered its findings after spending 12 days investigating in the Chinese city of Wuhan. They effectively ruled out the possibility of a leak from a laboratory. Victoria MacDonald has more. Victoria.
Yes, well, Christian, and if we were hoping for any clarity or any form of closure from this WHO fact-finding mission, we were left sorely disappointed in a 3-hour-long media briefing. We were told, yes, there was not a virus that had escaped from the Wuhan Institute of Virology, but that they couldn't find any evidence from the Wuhan seafood market. Now, that certainly will come as no surprise, given it was fairly widely known to have been thoroughly cleaned early on. The team's work had uncovered, they said, new information, but that it had not dramatically changed their picture of the outbreak. They're still starting with bats as the likely culprit, but probably not bats in Wuhan, and they are saying perhaps there is another animal species in between. And they also said they did not think that the outbreak had started in Wuhan Where, though, they don't know, maybe in another country or countries. And they added that the outbreak had not been going longer than when the first cases were reported in December 2019 in Wuhan. So clearing, in effect, the local authorities there. You know, the WHO has come in for a lot of criticism for being too gentle and too unquestioning of the Chinese at the beginning of this pandemic. And this joint investigation with the Chinese Health Commission will not satisfy those critics, although this does not cast aspersions at all on the team that was sent out there. But you are left, Krish, with a feeling of, is that it? And was it really worth it?